welcome to another edition of Currently in Quincy. I'm Joe Catalano, and on today's program we will chat with Cynthia Sierra from Mannett Community Health Center here in Quincy. First, though, as always, we do check out the weather and news for you. Currently in Quincy, it's overcast, 38 degrees right now, mostly cloudy today. Pretty mild, though, temperatures in the mid-40s later on this afternoon. Not too chilly tonight, only dropping down to the upper 30s. Things are going to change big time tomorrow. Windy, warm, and wet. Look at highs tomorrow into the low, maybe mid-60s. We'll have some rain in the morning, maybe a midday break, and then some strong storms possible late tomorrow night. Temperatures will dip into the lower 40s, but it clears on out of here for Sunday with a mix of sun and clouds. High Sunday into the mid-40s and a mild stretch into next week. Definitely above normal temperatures with highs in the low to mid-50s probably through the middle of next week. Again, cloudy and 38 degrees in Quincy right now. In the news today, Quincy Mayor Thomas Koch agrees that some of the curriculum in the Quincy Public Schools can be updated to better reflect the diverse student body. Koch was responding to recent changes that were implemented as a result of incidents of hate speech and racism that prompted a student walkout at Quincy High School last month.
Well, I think one of the fair criticisms on the curriculum was, in some ways, the curriculum should perhaps more reflect some of the diversity we have in our city. There are some great authors that could be African American or Asian American or, we growing up, probably the books haven't changed in English classes in 50 or 60 years. So we're teaching, obviously, the same, way in the sense of, teaching kids to learn. And obviously, reading is an important aspect of that. So that's one example, Joe, that I'm not talking about changing history. I'll never be part of that. And I'm not part of watering down history. But I think it's fair to say that for the population that we serve, for them to feel a little bit more comfortable, to have some more books, for example, in the program that would better reflect what their experience has been as well, culturally. So we have work to do, but I don't think we should be throwing the baby out with the bathwater. We have an excellent school system. I think that it's time we settle back in and get back to basics, because I don't care what your cultural background, we're preparing these kids for the real world. I believe we got to get back to the old basics of math and science and English and what the tools they're going to need in the real, whether they're going further for education or whether they're going to the military or a career, the tools they need to get out and navigate the world they're going to live in.
Schools have agreed to hire an equity, diversity, and inclusion coordinator, update the student handbook, add books from more diverse authors to the curriculum, provide staff training on cultural, social, and emotional learning, provide a more diverse culinary curriculum, and perhaps initiate student-run assemblies and peer mediators to solve problems. Superintendent Kevin Mulvey said he wants students and parents to know that their concerns are being taken seriously. The Quincy City Council will be setting the new property tax rate during their meeting on Monday night. Council President Nina Liang understands the importance of the issue.
It's always, I think, a very anxious time for all of us on the council. We need to do what we can to best sort of balance, making sure that people's potholes are filled and that, the streets are paved and that, our libraries are fixed up and that our school has proper insulation, right? And offsetting that with making sure that people can afford to stay in their homes and put food on the table. And it's an extreme challenge that I think any city or town, no matter the size, is dealing with. But you add on top of the fact that we are, such a quickly growing city, we are a desirable city, I think, for folks to want to come and stay here, facing the pandemic still, there's a lot of things that get factored in this time around too, that I think we have to take into consideration. And so it's not something that we can necessarily change going into the meeting on Monday, right? It's, again, set by the conversation we had in the spring with the budget. But there's certainly a lot of information that we'll be able to find out and hear about, and then also make sure to share with our constituents.
Mayor Thomas Koch has said he anticipates an increase of under $300 for the average Quincy household. Taxes went up by only $154 this year. A virtual public hearing about the tax rate is scheduled for Monday at 6:30 on Zoom, followed by the full council meeting. You'll be able to watch it live right here on QATV. A Quincy man who was wanted for multiple motor vehicle violations is now facing motor vehicle and drug charges. 26-year-old Dylan Costello was arrested this past Tuesday after officers spotted his car parked on Prout Street in West Quincy. Police say Costello tried to flee by driving in reverse, but was arrested after being forced to stop on the dead-end street. Officers also found methamphetamine packaged for sale and $502 cash in the car. Costello was wanted on 9 outstanding arrest warrants for multiple police agencies and faces these new charges in Quincy District Courts. Footprints in the snow helped lead Quincy police to a suspect wanted for breaking into a garage this week. 33-year-old Carrie Ann Keeney of Weymouth is charged with breaking into a garage at 31 Water Street at around 3 a.m. Thursday and stealing a bucket full of power tools. Police and a canine tracked Keeney to a nearby backyard following footsteps in the newly fallen snow. Keeney now faces breaking and entering and drug possession charges. The tools were recovered. This coming Monday, it's the last day to purchase a special T-shirt that helps with suicide prevention among veterans. Quincy Police Department is selling these shirts to raise funds for the Home Base Foundation, which is committed to healing invisible wounds such as PTSD and traumatic brain injuries for all veterans. It is the largest private sector clinic for veterans in the U.S. Now, the shirts are made from the same material as the police department's Pink Patch T-shirts, which raise money for cancer research. You can purchase those shirts for $25 on the police department's website. Quincy Veterans Council observed the 80th anniversary of the attack on Pearl Harbor this past Tuesday. Quincy Mayor Thomas Koch said the ceremony is vital to educating people about the cost of freedom.
History repeats itself. Evil still exists today. We've got to do a better job of teaching our young people the facts, because everybody is entitled to an opinion, but they're not entitled to the facts. So let us work harder on teaching our young people what sacrifice is all about, that this incredible society that we enjoy didn't just happen. So many died to give us what we have today. You know, during the General's event we had, when we dedicated the General's Park, to a person, each of those generals in our conversations would say, you know, we have a lot of challenges in this country, but I don't think people realize how good they have it here. They've been in all corners of the earth, the world, and have seen some of the challenges some of the people face. So let us be mindful and grateful of what this great country is all about, and it wouldn't be here if not for the veteran. God bless.
During that ceremony, Carol Walsh from Quincy held a photo of her uncle Santo Napoli, who died during World War II at the age of 21. Quincy Veteran Services Director George Nicholson noted that there are only about 200 survivors of the Pearl Harbor attack still alive. The U.S. Naval Support Center in Quincy sent a large contingent of personnel to Tuesday's ceremony. Coming up, we chat with Cynthia Sierra, CEO of Mannett Community Health Center. That's next. Welcome back. Really pleased to welcome back to the program Cynthia Sierra from Mannett Community Health Center to give us an update on what's been happening at Mannett and what will be happening in the new year. It's so great to see you, Cynthia. Thank you for coming.
You too. I'm really happy to be back. Thank you for having us, Joe.
It's our pleasure. And as I was saying before we went on this morning, it's an open door. So come over anytime.
Thank you. Thank you for that hospitality.
Absolutely. Great to see you coming off the Quincy Christmas Parade as one of the Grand Marshals this year. Wow, what a treat.
It was great fun.
Yeah.
What an honor, and what an honor to be recognized with the City of Quincy and the public health staff. Fantastic for our staff, as important, fantastic for our volunteers that took to the float and took to the parade route, and just humbled. I mean, truly humbled and honored to be part of it in such a way. So thank you. It was fun. What a wonderful day. What a wonderful day. Yeah, great fun. We had great weather, and
yeah, it was a nice day.
Yeah.
The mayor had just high praise for Mannett and really felt that he wanted to recognize Mannett's response to the pandemic. He realizes the value that having a community health center in the city has. A lot of communities don't have their own community health center. And from day one of the pandemic, really, Mannett stepped up first with testing. That was before even vaccines were available, right? And then
Absolutely.
as soon as they were, you launched right into offering vaccines, and you haven't stopped 42,000 shots later.
Absolutely,
Yeah.
yes. We're still vaccinating, and really pleased and proud to do it. I do have to say, Joe, yes, community health centers make such a difference, and communities need their community health centers. But it was the open arms of the city of Quincy and the other communities that we work within that allowed us to lean in and to truly be part of a pandemic response. And so it was a wonderful recipe, the partnership that we had before the pandemic. And grateful that it helped launch a further response. And to that end, yes, we started with testing, and it was shoulder to shoulder with the City of Quincy support and many partners. And it was last December, in fact, that the first shipment of vaccine arrived
Seems
right
so
here in
long
Quincy
ago,
for us.
but yeah.
Right?
Yeah.
And we vaccinated steadily throughout
Yep.
the winter and into the spring, and slowed a bit, as you can imagine, in the summer. And then October was really that opportunity and call to action with the ability to vaccinate more children and to
Yes.
continue that work of boosting folks, if you will. And so, what a partner the city has been. We couldn't do what we've done in our response to the city of Quincy without them. Then the lifeblood, the wings behind the program truly are volunteers, our
Yes.
staff, and partnership with these amazing volunteers.
Are you finding that people are learning about Mannett for the first time because of the pandemic?
It's a great question, Joe. I think we would have to say, in fact, yes, for sure. But also, I think as important to us, Joe, they're also learning about primary care. Because at our core, what we do is primary care and making sure that there's no one that's left behind from that opportunity to engage in primary care. And along with that is disease management, it's preventative health services. Joe, it's also behavioral health care, which is both mental health services and substance use services for patients of primary care. So we're so pleased that we've been able to welcome new patients and support more community residents through the pandemic, but truly just the primary care and being able to make sure that folks have access to it and they have prioritized that in their own lives. And if for some reason they've strayed away from that, Joe, and maybe the pandemic's been one of the reasons for that, this is an opportunity, and even here today, a visibility reminder of how important it is to have a primary care provider in your life.
Yeah.
So-
Who can be a patient of Mannett? Who can receive services from Mannett? We should talk about that. Maybe, I think there's sometimes a
Absolutely.
misconception about what a community health center
Absolutely,
does. Yeah.
yes. So, Joe, we have our 3 locations in Quincy. We're actually in Hull, and we're in Taunton, and we opened in Attleboro
Yeah.
this July, late July. the
Still
end of
expanding, yeah.
We are,
Yeah.
we are, and we will serve anyone
Yes.
that needs primary care. And our patients come from all walks of life, Joe. They come from over 38 different zip codes.
Really?
Yes, in this region, in the South Shore, Southeastern Mass. And to find more information about how to be a patient, you can go to our website, and our phone numbers are there, and our main number is 617-376-3000. And again, all walks of life. So all ages, all abilities, all languages, all races, all ethnicities, all disease states. We serve newborns all the way up to our most senior patient is, I believe, 105 years old, Joe.
Wow.
Yeah. And yes, and so you'll have wonderful care
Yes.
coming to Mannett in locations that are welcoming and they're accessible, and with an amazing first-rate staff that are ready to serve.
And can you have private health insurance and still receive services from Manet?
Absolutely,
Yeah, 'cause I think that's
absolutely.
one of the biggest misconceptions.
Okay. Oh
yeah.
well, and then I'm really glad to clarify
Okay.
and appreciative that you raised that,
Sure.
Joe. Yeah. So whether you carry a commercial card, one of our commercial payers, and you receive your health coverage through your employer.
Mm-hmm.
Absolutely, we would love the opportunity to care for you. If you're on Medicare, if you're on Medicaid, it's agnostic, if you will. We're here to serve.
Yes.
Our emphasis, of course, is on making sure that those that are medically, socially vulnerable are not left behind.
Right.
And so
Yep.
there's no wrong door. And really pleased and proud to serve all patients that need our care, need our services. But for sure, a really proud partner of a health safety net. Yeah,
Yep.
to ensure that we're here for all.
We've seen throughout the pandemic so many healthcare workers either retiring or moving on to different careers or suffering, I guess, from the stress of it all. Have you seen that at Manet as well?
You raise a really important question and a really important focus, I think, Joe, of our times.
Yes.
And providers and staff as well, that perhaps they've chosen early retirement, right? Just a time that we have to certainly acknowledge that for all of us, and for sure, I think what I call the healthcare heroes.
Yep.
And so those are folks that are delivering the primary care, delivering the behavioral health care, but they're also, they're greeting the patients, they're taking the phone calls, they're helping to staff the testing clinics and the vaccine clinics. I think for us, what's truly, truly important is to make sure that we have those programs that are available to mentor our staff. We've brought in, as an example for us, what's worked is sort of mindfulness and meditation offerings for our staff. We very much encourage our staff, Joe, to take their vacation, to enjoy their vacation, spend time with their families and hobbies that they care about.
Yeah.
I also think for us, our volunteer movement, if you will, the most amazing assembly of volunteers, again, from all walks of life, have truly stepped up and stepped in and shoulder to shoulder and partners with our staff and vaccination efforts and just such a wonderful representation of community in public health response.
Yeah.
And I just think that partnership alone for healthcare professionals, when that can happen, that amazing
When they see that, yeah.
surgence of volunteers coming forward to lend a hand. And Joe, retired nurses as an example.
Are they coming back? Yeah.
Absolutely.
Really?
Retired providers, retired folks that have been part of leadership in the healthcare landscape for some time. Pandemic came and really reignited that care cause and passion for them.
Wow.
And Manet's been able to be, if you will, a volunteer home.
Those are unsung heroes, the
aren't they?
volunteers. Yeah, they really are. They're doing
Absolutely.
it purely out of love and commitment to their
Absolutely.
craft. Yeah.
Oh, they could not stay on the sidelines.
Yeah.
I mean, they were responsive to the public health needs, the pandemic, but also those very sensitive issues of wanting to provide some respite. And oh gosh, Joe, I mean, just they truly are quite exceptional, and there's such a story to tell. I think for us, the story is still being written and it's still in motion.
Yes, yeah.
With our pandemic and
Yes.
with our volunteer response, but yeah, there's something magical about it, Joe, frankly.
Yeah. And
Yes.
I'm sure in your professional career, this must be one of certainly the most challenging, but also the most rewarding times that you've had.
I would say
Yeah.
absolutely. Yeah, it's been humbling to be with an amazing team
Yeah.
at the health center, amazing staff that have seen this pandemic through, new staff that have joined
Really?
a community
Okay.
health center in a pandemic, and to be just witness to and part of this volunteer response. And so from Quincy to Hull to Taunton and Attleboro, just a magnificent honor, frankly. Joe, it's a privilege. You know, it's a privilege to come to work every day.
I remember when this first started, that was the word that you used, Cynthia, when you were able to start your vaccination
goodness.
clinics. You said it was a privilege to be able to vaccinate people.
Absolutely.
Why do you feel that way?
It is a privilege. It's a privilege to represent and to be among wonderful colleagues and community health centers,
Yeah.
both here at Manat, and then we're part of a wonderful statewide and national association. And it's an honor and it's a responsibility. And the public and the community, Joe, and our patients, whether they're new, they're existing, they've been with us for so many years. There's a trust that they're placing in us, in our staff, and our organization, in our governance, to take care of them, to educate them, to serve them, and to be responsive to them. And I think that's where the privilege is.
Okay.
Yeah.
You're still doing it. You're still testing. You're still vaccinating. Let's bring folks up to date on where those services stand right now.
Absolutely, yes. And so, as a companion to the work of primary care that's happening every day in behavioral health services, we've maintained a testing program for COVID-19 and then vaccination services for COVID-19, and we've also done a significant work around flu, actually,
Oh, okay.
as important, frankly.
Oh, yeah, this
season. just influenza, right? Important to keep us safe and remind us of that. So in terms of COVID-19 testing specific to Quincy, we offer that service traditionally Monday through Saturday by appointment at our 110 West Quantum Street, North Quincy facility.
Okay.
We offer it sort of barrier-free in partnership with the City of Quincy each Tuesday at 180 Old Colony.
Okay.
And results are usually back to consumers of the service within 24 up to 48 hours.
Okay.
So by appointment again in North Quincy, walk in between 1 and 4 at 180 Old Colony each Tuesday. Vaccination service along with testing service offered at most of our practice sites in the City of Quincy at 180 Old Colony, and thankful and appreciative to the mayor and the staff for the access to that building.
Right.
Because in healthcare and social services, of course, I think they would say the same. Space is one of our biggest challenges, and in a pandemic you need to make sure that you have ample space.
Of course, yeah.
To keep safe. And so we offer vaccination clinics there on Tuesday evenings and also Thursdays afternoons into the evenings. So 5 to 7 on Tuesdays, 1 to 7 on Thursdays. Today we're offering 1 to 4 Fridays at 180 Old Colony, and then we'll be there Saturday morning for a Saturday session. And we're quite busy. Between last Friday, December 3rd, and last night, we were able to provide over 1,700 vaccinations, and so a combination of adult vaccinations, boosters, and then we vaccinated over 500 kids.
Really?
Yeah.
Wow.
So
Okay.
we I think what makes our clinic unique too is that we do have all vaccine types available, and we're able to safely vaccinate children, adolescents, adults, and elders inside of these clinics. And the lifeblood, Joe, the best community health center staff you're going to find at Manat. Just amazing in what they do, but also coupled with these exceptional volunteers.
And just yesterday we saw the Pfizer booster be made available to younger teens. So I'm
Absolutely.
sure you'll be seeing an influx
Absolutely,
of those
yes.
as well. Yeah.
So FDA approved emergency use,
Right.
and Dr. Walensky with the CDC. So at Manat, we're waiting for that word from the State Department of Public Health, and similar to how we responded with
see.
the pediatric Pfizer. Once all approvals are granted, yes, we'll be there and we'll be available, and really grateful for the partnership with the state and the city, and if you will, our volunteer and our staff army that are able to help put those shots in the arms.
Do children need parental permission, Cynthia?
Excellent question, Joe. They do.
They do.
So
Okay.
if you are under the age of 18,
Yep.
we absolutely do require parental or caretaker consent.
Okay.
Yes.
Okay.
Good question.
Bring your card with you, I'm guessing,
yes,
so you
Joe.
can be updated.
Oh my
Yeah?
goodness, yes. I'm thinking about our vaccine card volunteers, and they would want us to say that. It's so important that you bring that white square state that vaccine card that you have with you. Bring that to your session, yes.
Or if it's your first time getting vaccinated, you'll get one. Right?
Absolutely,
Yeah, okay.
absolutely. Yes, wonderful. We will provide that for you.
Giving Tuesday was not too long ago, and I know Manat is a nonprofit, 501c3 corporation. How did your fundraising goal make out?
We did well, Joe. Thank you for raising that. As important as our volunteers are, important too, the support, the philanthropic support from the community. Giving Tuesday, the committee would be so pleased to share, Michelle Duggan, our development director, that we exceeded our goal for Giving Tuesday.
That's great.
And just so privileged to receive those arms, if you will, around the mission that are supporting us and propelling us forward.
Yeah, the goal was 10,000. You were over 11,000.
Absolutely,
so that was great.
absolutely, yes. And Joe, I think it's important to say on the committee's behalf, our amazing volunteer philanthropy committee, that it's a gift in any size, Joe.
Right, exactly.
Right, absolutely, a gift in any size. We honor it.
There's a lot coming up, I know, in 2022 at Manat, but we'll have to wait until then to talk about it because we're out of time.
Oh my goodness, Joe.
I told you it would go quickly.
We'll come back. We'll come back.
Please do.
Thank
Please
you.
do. Happy, healthy holiday season.
Thank you for what you do.
You're very welcome. Thank you. We will take another look at the forecast for you for the rest of the day today. Kind of what you see is what you get out there, lots of clouds. It should warm up into the mid-40s this afternoon. Not as cold tonight as it has been the past few nights, only upper 30s. That sets the stage for a really mild Saturday, but a wet and windy one too. Mostly in the morning and big storms late overnight tomorrow night. It'll clear out for Sunday, pretty nice, even warmer again on Monday. Thanks again to Cynthia Sierra for joining us from Manat Community Health Center.
Thank you.
Thank you to our crew. Thank you for watching. Monday here on the program, Paul Gorman of the South Shore YMCA is our guest. Until then, have a great weekend.